Dr. Zinia Thomas invites us in for a tour of Radiance Wellness in St. Louis. Psych CEO David Flores visits with GoDaddy founder Bob Parsons and Numinus CEO Peyton Nyquist and Superposition on music as medicine. Welcome in, family. I'm Autumn Tribbitt, and this is Spotlight in Focus. Dr. Zinia Thomas is a St. Louis-based psychiatrist and owner of Radiance Wellness, a facility for healing, offering cryotherapy, IV nutrient and ketamine therapy, and more.
Hi, I'm Dr. Zinia Thomas, owner of Radiance IV and Wellness and Radiance Ketamine. Welcome. You're inhaling some essential oils, so it includes aromatherapy too. Our nurse's office where we can prepare your IVs and ketamine. We have a couple IV rooms. We do have a kind of individual room, so you have an individual experience. This is our cryotherapy and hydromassage room. Salt caves were very popular to help people's respiratory issues. Part of healing includes detoxification, and one of the best ways we can do that is through our skin. So ketamine therapy has been around for a long time, decades. Ketamine is primarily an anesthetic agent, and so has been used for surgeries since the 60s. What they found, even in the surgery world, it is beloved. And what I've learned in talking to surgeons is that people actually recover faster when they're getting ketamine as a pre-anesthetic than if they would get another anesthetic. And I believe, after seeing what's happening with psychiatry, it's because of its dissociative nature. I like to say to patients, your spirit leaves your body, and then the surgeon can operate. And really, your body doesn't know the difference between a surgeon's scalpel and a knife of the thug on the street. It's all trauma to the body, and you want to be far away from that as possible. So ketamine offers that dissociative or disconnect, and until the surgery's done, until you're sewed up and until it's safe to return, that's when the medicine wears off and you come back. And when they see post-op, they're walking faster than usual, talking better, and kind of better recovery. So especially those kind of shorter surgeries, people recover faster. For me now, I feel like ketamine has two mechanisms of action. That one, it can really regrow our brain, and so connect these faulty connections that happen with trauma. We can kind of reprogram those or reconnect those in a nice way through that neuroplasticity effect. And then the second mechanism is that ego dissolving. Because of its dissociative state, you are kind of leaving your body and kind of going to your subconscious. And really, we really don't have the ability to do that. And so by seeing sort of what's happened in our past, especially maybe before we've had time to make memories, in our pre-verbal period, we can kind of see, and really, unless we kind of know where our problem's coming from, it's hard to make changes. So I think ketamine offers a glimpse into our past where we can really understand where these patterns associate from without that anxiety or pressure or perception that we may bring with us in reality, and we're really able to kind of make better changes in the future. We have a couple IV rooms. And we first opened in 2017 with the typical IV nutrients, the Myers cocktail, the after party or hangover cure, and NAD, and slowly, obviously, added ketamine since we had the setup to do that, and have found amazing results. We do have a kind of individual room, so you have an individual experience. I remember reading in psych journals in 2006 about a study that came out through the NIMH, National Institute of Mental Health, where they were using ketamine sub-anesthetic doses for treatment-resistant depression. And they showed amazing results. 6 infusions given within a 2 to 3 week period of time yielded about 70 to 80% remission rates for these people that really had no other option except maybe ECT at the time. I remember reading about it, but in a typical psychiatric practice, it's giving an IV was unthought of. And so I was like, oh, I wish I could use that for some people, but really only had my, pills that I could offer. I did open Radiance in 2017, so by 2018 I was using ketamine. We have nurses and staff to really make that easy, just fit right in. But even at that point, it was really only used for treatment-resistant depression, people who were failed other treatments or maybe had severe suicidal thoughts that, this also shows to almost eliminate suicidal thinking with one infusion. While I saw amazing results, it was kind of few and far between in terms of patients and access and use. But post-pandemic, it has changed. The rates of mental health have tripled, and people are searching. Even addiction, the rates of alcohol have gone up 3 or 4 times, and we really have no good tools to use, or the tools we have been exhausted. And so I think this psychedelic renaissance is starting, and while we are hoping for other things in the future, ketamine is available right now. And so people are seeking it for not only treatment-resistant depression, but other sort of mental health issues, because it almost becomes unethical to have people fail or wait 6 months before they can try this when it works so remarkably. So we've had people from, major depression, bipolar depression, PTSD, chronic pain, postpartum depression, eating disorders, addiction. Even there's a study at Hopkins that just came out maybe a couple months ago that showed 3 infusions of a certain dose of ketamine eliminated alcohol cravings for up to 6 months. And so these are huge improvements from something that is so safe and available. We also tend to do our ketamine IVs in here and have my first ketamine consultation with me, and where we can kind of go over your history and make sure you are appropriate for the treatment. The pink Himalayan salt wall does provide some release of ions to kind of neutralize and purify the air, and it really is a very nice ambiance when you're going into that subconscious trip, so to speak. I think ketamine has so much potential, but some of the impediments to receiving the treatments are multifold. I think it is in the medical, field. So I think there's some expectation that it's sort of covered under insurance. While it has been around, it's sort of off-label for mental health reasons. So the cost is a barrier. I think in addition to just the cost being a barrier, there's a inherent barrier when you're treating depressed people and sort of getting them to have that motivation or even self-worth that this is what they deserve and that this could help is a big barrier to overcome as well. And I think maybe how it's being implemented now. Obviously in a surgery setting, it's pretty cut and dry. You start the medicine and you stop it. But when we're talking about mental health, I think there's a big therapeutic component you can add in to really make those gains triple. And one is sort of, impressing upon the person about the set and setting. They know that in the mantra in the psychedelic space, but your mindset going into the procedure is very important. I think a lot of these people, especially with treatment-resistant depression, have been on everything in the past. Nothing has worked, kind of getting discouraged, or what's the big thing about this treatment? How will this work? And that is kind of limiting, because it will work, and it almost, I like to think of it as a catalyst. It'll only work as well as you allow it. And so having some more open thoughts, very explorative in nature, where is this coming from? What is the cause of my dis-ease? And not that someone knows that. If they did, they would not maybe have those problems, but putting it out there so that the thoughts that come up and then after the procedure will kind of make sense. And again, once we can know where some of these things are coming from, it's easier to make changes.
Psych CEO David Flores spoke with Bob Parsons, GoDaddy founder, about his journey into psychedelic wellness.
I know a lot of folks out there are certainly very, very familiar with Bob Parsons, the wildly successful businessman, entrepreneur, self-made billionaire, of course, founder of GoDaddy. And, but I think the side that they may not know about you is, the time that you spent in Viet Nam and how that experience would end up, for better, worse, otherwise end up shaping a good majority of your adulthood life and leading you to where you are here today. So if you wouldn't mind, sir, maybe starting with that, talking about your experience there in Viet Nam, some of what you experienced, saw, and how that would impact the person that you became, again, to the majority of your adult life.
During the war in Afghanistan, all right, during a typical week, the casualties on both sides, killed and wounded, run about 150 a week. In Vietnam, when I enlisted, that was about 33,000 a week. So I mean, this was a righteous war, if you look at the Marine Corps' casualties over there, the Marine Corps took more casualties in the Vietnam War than it did in World War I and II combined. So I mean, brother, this was a righteous war. I mean, it was rocking and rolling. When I got there, I was 18 in a couple months. I was one of the youngest guys in a platoon, if not the youngest. And I found out that the guy in my squad, that was a new squad leader, it was a senior man, had been there for 6 weeks. Everybody else left, was either killed or wounded. Right. So I seen my first when I seen my first combat, I wasn't with them but 4 hours. And wow. Yeah. So during the first night, one of our brothers was hurt horrifically. During the next night, our point man hit a trap and blew his legs to shreds. I had to I helped carry him back about a mile and a half to the medevac point. And and that's the way it went. Right. I lasted 1 month, 30 days, 31 days maybe. And I was walking on a point team and going through a village at night and hit a tripwire. It was attached to a North Vietnamese hand grenade, and that, I caught shrapnel both legs, left elbow, and was medevac to Japan. When I came back, and I worked as a laborer in a steel mill for about a year. And then I went to the University of Baltimore. I majored in accounting, and believe it or not, because nobody back then believed it, I graduated magna cum laude and passed CPA exam first time, and was able to start a few businesses. I've started 3 now that debuted on the Inc. 5000 list low. Right. And so I wouldn't have done any of this without the Marine Corps. Marine Corps turned me around, buddy. I mean, they taught me everything. They taught me discipline, responsibility, all that. And, I owe them everything I've ever accomplished. Now that's on the good side.
Right.
On the negative side, I came home with a case of PTSD to beat the band. The Bob Parsons that came home was very different than the one that went over. Guy went over, liked being around people, nothing much bothered him, pretty gregarious, liked going places, just easygoing, happy as a lark. The guy that came back, not so much. He was a quick temper. I didn't like being around people, didn't want to go to any events, and I always wanted to be by myself. Depressed,
right?
All the typical symptoms of PTSD. Now, my PTSD most certainly cost me 2 marriages. The crazy part is probably one of the reasons why I was so successful, because I buried myself in my work, which was how I was able to get, to kind of go on. Right. But I'm now married to my third and final wife, who was the love of my life. And she, in discussing with her, I got this Michael Pollan's book, How to Change Your Mind. Yeah. And my guess is you've heard that a lot.
Of course. Yes.
Oh man, what a game changer. What a good job Michael did. So I read that, and then I talked to my wife, and I said to her, I've never done anything like this. I'd like to try it. And so she had me hooked up with 2 people that kind of treat vets under the radar. Within 2 weeks, told me I didn't have a problem. Bang. Right. So I got together with them in Hawaii, and over 4 days, I did guided therapy using psychedelics. Now, the important thing to notice when you're being treated for anything like this with psychedelics is psychedelics play an important role in it. It'd be very difficult to do it without them.
Right.
Matter of fact, it takes forever to do it without them. But with them, with the right guided therapy, it is the cure. Here's the deal. It had been 49 years since the war, and thanks to psychedelics and the counseling with it, I finally came home, David.
That's beautiful. That's beautiful. And, I love that, finding your way back home. Took a while, but you made it there. And, you say psychedelics through counseling, we also use the term psychedelic assisted therapy. I want to shed some light on that, because I think that's important, especially out there for folks, especially those that are somewhat skeptical over psychedelics. How important is the element of therapy, of counseling? Because the way I've always looked at it, Bob, is, psychedelics alone are not the silver bullet. They're not going to cure depression, PTSD, addiction, anything like that. But if you use it wisely and use it as a key to unlock certain parts of yourself that maybe you've repressed or that you've locked away, in your case, perhaps locking away that trauma that you experienced in Viet Nam, it allows you to confront it in a manner that allows you to identify where the issues exist and then go head to head with them. Would you say that that's sort of how things played out for you? And I want you to share that, because I think it's important that people understand that it's not just the psychedelics, but it's the psychedelics in combination with the right therapy and the right counseling.
And that is 100% true. And the other thing is that, when you're going through your guided therapy with psychedelic, people, sometimes people say, well, man, it was a lot of fun. At least you're using psychedelics. No, because see, you're dealing with all the stuff that caused the PTSD, right? Or whatever it is, the anxiety, whatever it is that the individual's dealing with, and it's hard. And you sometimes feel like afterwards, man, I don't want to do that again. But you got to do it. You got to go through it because that's what causes the healing, right? Now, what the psychedelics do is they make you willing to listen, willing to bring it up, and then open to dealing with it.
To hear the full half-hour interview with Bob Parsons, please visit psychedelicspotlight.com.
Numinus Wellness recently sponsored the Immersive Healing Music event, Music as Medicine. Here's CEO Peyton Nyquist and artists Superposition.
So Peyton, thanks for joining me today. Really excited to speak with you about this incredible event, Music as Medicine. I'd love to ask you to speak to the origins of the event, if you would, please.
Yeah, John Hopkins and I connected probably about a year and a half ago, and with that, sort of right around the launch of his album, Music for Psychedelic Therapy, which was a fairly pointed title for his album, and really, sort of resonated with each other in terms of, I would say, the sort of passion and ethos that we were both coming to the space with. And I've been a fan of John's music as well as some of the other artists that we have, and really, have always obviously had a deep reverence for music and in regards to how that intertwines with psychedelic therapy or ceremonial work or not. And John's album is really an amazing tool, frankly, in regards to psychedelic therapy as well. And so we started to look at just different ways that we could interact and build community and awareness around not only the album, but also psychedelic therapy in general. And so that's really where the idea for the event came from. And it's sort of blossomed now quite a bit with East Forest and a few others coming on board as well.
Well, collaboration is exciting in general, and I think that the nature of the work that you're doing, there's a collaborative component. There's many moving pieces. There's integration of a lot of different modalities as part of the overall healing. And music, I think, is such an incredibly powerful tool, perhaps even woefully underutilized. And that's one of the most exciting things. I think John alludes to it, and these quotes on the press release are beautiful. I'd like to read the one quote from John that you included. Psychedelic therapies are moving into legality across the world, and yet it feels like no one is talking about the music that accompanies them. In indigenous psychedelic ceremonies, the music is as important as the medicine and has been for thousands of years. Music is how you navigate the space. I think that the end of that quote alone is so resonant, so powerful. Music is how you navigate the space. You can't do this in a vacuum, can you?
No. And that's to John's quote, if you look at the indigenous or ceremonial use of psychedelics, whether it's ayahuasca, peyote ceremonies, San Pedro or Wachuma ceremonies, music is not only the, it's sort of the focal point of a lot of those ceremonies, but it's the way in which people are invoked or engaged with in that work to either evoke emotion or to John's point, navigate the space. And when you think about anybody who's been in an ayahuasca ceremony, when you think about an ayahuasca ceremony, for me, the substance of the ceremony is the music, is the icaros and the tools that are utilized in that space. They're not separate. Then it's not the drug and then the music. It's the container that's created with both substance and sound. So I agree with John in terms of just the underappreciation that maybe we've taken in regards to the more clinical researched approach to psychedelics lately. I think folks like Johns Hopkins, obviously, you can get there. And Johns Hopkins, not to be confused with John Hopkins. If you look at the information that they've put out, I mean, you can get their playlist on Spotify, and it's amazing. But I'd love to see more research with regards to how music interacts with a therapeutic experience as well.
Yeah, well, we know the power of music. I personally think that music is in contention for the greatest utilization of Homo sapien talents ever. Talk about these spaces and how they might be a new utilization of physical activity, of coming together, of something that we prioritize for ourselves in our mental health regimen.
Yeah, and I love what you said around mental wellness. My hope is, you know, with the work that's being done at the moment, we can start to transition from, you know, mental health treatment, which is imperative, to, you know, preventative mental health treatment, or mental wellness, as you put it. We shouldn't have to wait until people are anxious, depressed, suffering with substance use disorder, and so more spaces where, frankly, the other aspect of this that I think is integral is community and connection with community. And I think that's really what we're trying to create, is healing spaces where people can have a shared experience and connect with other people who have had either the same shared experience or a similar shared experience. And I think that resonates in psychedelic work as well. You know, we talk a lot about integration and this sort of notion of what is integration. And for me, integration is just, it's your life. It's not a program that you don't have your psychedelic therapy or whatever it is, and then you have your integration program and then you go on. Integration is how you're going to walk in your life. And so with that, you need to have, you know, community and collective experiences that you can resonate with other people and have as an aspect of your life, so that those experiences that you do have in therapy are not just, they're not just considered experiences that you once had and then you know, sort of transition, or that's where you can see things potentially not stick. And so I think with these kinds of events, to create communities where people can connect, have a shared experience, and that's really, you know, where a significant amount of the healing happens, is it's so much to be done in community with people, so that those experiences can really land and be mirrored back.
Justin Beretta is in the house.
Hey, how's it going?
Good, man. Thanks for being here.
My pleasure.
Yeah, so I want to give you a chance to talk about everything that went down with Music as Medicine.
Wow, it was incredible. I mean, I'm really still wrapping my head around what happened there, but it's really special what happens when people go into a state of deep listening. I really believe in the power of deep listening, and I think that, you know, for the past couple years, there's been a lot of sound baths that have been happening around Los Angeles and around the world. And it's funny because when I first went to one, I went to one at the Integratron out in Joshua Tree, and I was thinking, like, what is a sound bath? Because when you have the instruments, you have these very resonant instruments, a lot of like bowls and forks and things that like vibrate your body. And then you have state of mind, because what I really noticed going in there, and I come from the world of dance music and from live electronic music, and the point people are there, they come to dance, they come to have their face pummeled by bass or whatever it happens to be, have a good concert, get entertained. But there's the state of mind that people were showing up to these sound baths, and I started to go to them, and I was really fascinated by the sense that people were almost putting themselves into a meditative state. Like they went there and they had an intention that they were going to receive something, that they were going to attune with these instruments or with whatever was happening. And then people you could put you into non-ordinary states just through the music. And so I think that the state of deep listening is really, really powerful. And when you combine it with immersive sound, I again, like coming from the world of live electronic music, like I am addicted to making music for sound systems. I love electronic music. I love the controlling frequencies and sub-bass tones and playing live music together with a group of people physically is one of my favorite ways to transcend.
Beautiful. And so this effort to have this event that was sponsored by Numinus Wellness and had other performers at it, at John Hopkins, East Forest, yourself, there's another DJ as well. It was a purposeful event to create a curated space to provide the option for an immersive and healing experience. Healing is implicit in the intention, correct? There's an intention to heal that facilitating an event like this really has at the forefront.
Absolutely. And yeah, the DJ that played before us, Olive Komodo, is really incredible. She has a radio show that's one of my favorites, and her music really fit into this whole thing perfectly. But yes, I think when people show up together with the intention to heal, the music becomes, think of it, it's a totally different state of mind playing and recording music for healing that has this intention to think, hold the listener, hold the container for people to have their experience with the music. Typically that we perform at events like this, or in this one in particular, was if you listen really, really intently, there's a lot of layers there, or you can actually just sort of listen, lie back and feel it. So it operates on multiple levels, but it is really, it's really meant to immerse all of your senses in a place so you can sort of safely just go back and have whatever experience that you'd like to have. This event, you mentioned earlier, there are a number of sound bath or immersive sound experiences that are happening right now. It seems to parallel our coming into a better understanding of how to utilize things that we're already familiar with for new purposes. My mind always goes to cannabis, for instance. You know, a lot of us grew up just smoking pot in a very throwaway manner. But sometimes when you're talking to somebody that's quite familiar with the art of medicine, they'll explain how cannabis can be a psychedelic, can be transformative, can be used in a more therapeutic setting. So music is something that we have been using as a species forever to express ourselves. And I think we're really just starting to tap what's actually possible with this beautiful thing that we've created over time. Yes, I agree with that so much. And there's also something about, you know, having spent so much time away from groups of people, that the combination of music and then a group of people that are all there for the same thing. You know, we had, I think there was 300 people, maybe there was 250 in that room that night. You know, over the course of 2020, I spent so much time listening to ambient music, creating ambient music, and sort of like my own sound bath types of productions in my studio here. And that was the first time that I had played any of that music that we have created since 2020, together with a group of people. And it's a totally different thing, because I can feel what people are going through intuitively. Like music, it's like this connective tissue between us. And, you know, as I was there playing, there was a woman who was sitting in front of me who kind of like would sit up, and I wasn't even looking at her, but through my peripheral vision, I could just sense her sort of like weeping and then lying back down again and then sitting up, and whatever she was doing really made me feel the potency of the music, and actually feeling grateful for also the healing that I receive through this. So a lot of the times when we're creating music, if it's superposition or when I'm creating music, I'm using this for myself. And I think that if it works for me, if it feels good to make this, if it serves as sort of an intention holding purpose, then I think it would most likely do it for other people as well.
To watch the full interviews with Peyton Nyquist and Justin Beretta from Superposition, visit psychedelicspotlight.com.
I'm grateful for Dr. Zinia Thomas having us at Radiance Wellness and seeing all the amazing work they're doing at her clinic.
And I'm grateful to Peyton Nyquist and Justin Beretta for taking the time to visit with us about music as medicine. I think it's an amazing event, and I can't wait to be at the next one.
And I'm very grateful for Bob Parsons, who shared intimate details of his journey with us. Thanks for watching. Until next time, I'm Autumn Tribbitt. Be well.